and Secretary of the Board of the Trust Agreement. The board hereby delegates to the Chair of the Board, the Vice Chair of the Board, and the Chief Financial Officer of the district, each a designated officer, the authority to approve the final details and forms of the bonds. Section 3, pursuant to the authority granted to it by the Act, the board hereby authorizes the execution of up to 2 TRS transactions with J.P. Morgan Chase Bank and Bank of America, and the execution and delivery by a designated officer of the standard ISDA documentation in connection therewith in the form approved by council. The notional amount of the TRS transactions shall not exceed the principal amount of the directly placed Series 2026 bonds, and the initial term of the TRS transactions shall be no later than July 1st, 2036. Section 4, it is hereby found and determined that due to the character of the bonds, current favorable but volatile market conditions, time constraints, and uncertainty inherent in a competitive bidding process, the negotiated sale of the bonds is in the best interest of the district. The negotiated sale of the bonds to the underwriter and or to the purchasers of the directly placed Series 2026 bonds is hereby authorized. Each designated officer is hereby authorized individually to award the bonds to the underwriter or purchasers of the directly placed Series 2026 bonds pursuant to the respective bond purchase agreement hereinafter described, subject to the following conditions. A, the final maturity date shall be not later than July 1st, 2056. B, the amount of proceeds of the bonds available to finance the project shall not exceed $250 million. C, the district shall have received one or more disclosure statements from the underwriter setting forth the information required by Section 218-385 Florida statutes as amended. D, the sale and issuance of the bond shall take place before December 31st, 2026. E, the all-in true interest cost of the bond shall not exceed 5.5%, provided that with respect to any bonds issued in a mode other than a fixed bond, the initial interest rate thereon shall be used for this computation. F, the underwriting discount for the bonds other than the directly placed Series 2026 bonds being the difference between the par amount of the bonds and the purchase price to the district by the underwriter prior to taking into account original issue premium or discount shall not be greater than 0.5% of the par amount of the bonds. G, such other conditions as shall be deemed necessary by bond counsel or district counsel. Such designated officer is also authorized to select the principal amount, if any, of the debt being refunded, as well as the principal amount of each series of bonds, including any number of subseries or such series, the initial interest rate mode for such series, and the principal amount and purchasers of any directly placed Series 2026 bonds. Section F, the proceeds of the bonds net of the underwriting discount set for the bond purchase agreement shall be applied to finance and or reimburse expenditures for the project and to the prepayment of the refunded debt. The board finds that the use of the proceeds of the bonds as referenced herein will accomplish the public purpose set forth in the Act. Section 6, the preparation, execution, and delivery of the trust agreement, supplemental indenture, including the bond obligation thereunder, and continuing disclosure certificate with respect to the bonds are hereby approved in all respects, and the chair or vice chair and the secretary or assistant secretary of the board hereby authorized and directed to execute and deliver the trust agreement, continuing disclosure certificate, the supplemental indenture, the bond obligation, and the bond purchase agreement in substantially the forms presented at this meeting, together with such changes, modifications, and deletions as they, with the advice of the chief financial officer of the district and upon the advice of the district's financial advisor and the district's chief legal officer, may deem necessary and appropriate, including but not limited to changes, modifications, and deletions necessary to incorporate the final terms of the bonds as shall be set forth in the bond purchase agreement, and such execution and delivery shall be conclusive evidence of the approval and authorization thereof by the district. To the extent necessary or desirable, each series of the bonds may be issued under a separate trust agreement and secured by a separate obligation issued under a separate supplemental indenture, in each case substantially in the forms presented as this meeting, with such changes as are approved as stated above. Section 7, the form, terms, and provisions of the bond purchase agreement are hereby approved in all respects, and each designated officer is hereby authorized and directed to approve by execution and delivery the bond purchase agreement in substantially the form presented to this meeting, together with such changes, modifications, insertions, and deletions as they, with the advice of the chief financial officer of the district and upon the advice of the district's financial advisor and the district's chief legal officer, may deem necessary and appropriate, and such execution and delivery shall be conclusive evidence of the approval and authorization thereof by the district, all subject to the provisions of Section 4 above. To the extent necessary or desirable, each series of the bonds may be sold and purchased under a separate bond purchase agreement substantially in the form presented as this meeting, with such changes as are approved as stated above, including any changes necessary with respect to any directly placed Series 2026 bonds. Additionally, to the extent necessary with respect to any bonds in a variable rate interest mode, a remarketing agreement may be entered into between the board and a remarketing agent in form and content consistent with industry standards and acceptable to the designated officer and counsel to the board. Section 8, upon their execution, the bond shall be deposited with the bond trustee for authentication, and the bond trustee is hereby authorized and directed to authenticate the bonds. And upon the due and valid execution of the respective bond purchase agreement, the trust agreement, the supplemental indenture, and the bond obligation by the proper parties thereto, the bond trustee shall deliver the bonds to or upon the order of the underwriter against payment thereof. Section 9, there is hereby authorized to be finalized one or more preliminary offering statement in connection with the issuance of the bonds, which preliminary official statement shall be in substantially the form presented at this meeting, and for each preliminary official statement or final official statement, collectively the official statements in connection with the issuance of the bonds. The chair or vice chair of the board is hereby authorized to determine when each such official statement is deemed final for purposes of SEC Rule 15C212. The chair or vice chair is hereby authorized to execute and deliver each official statement on behalf of the district. The use of the official statement and the distribution of the official statement in connection with the marketing of the bonds are hereby authorized. The chair or vice chair is hereby authorized to make any necessary certifications to the underwriter regarding a near final or deemed final official statement, if and to the extent required by SEC Rule 15C212. Section 10, U.S. Bank Trust Company National Association is hereby appointed bond trustee and bond registrar for the bonds. Section 11, the Depository Trust Company is hereby appointed as the initial securities depository for the bonds, with Seed & Co., a nominee thereof, being the initial securities depository nominee and initial registered owner of the bonds. Section 12, the preparation, execution, delivery of the documents necessary for the TRS transactions, including a supplemental indenture with the TRS obligation thereunder, and standard ISDA documentation, including one or more confirmations, are hereby approved in all respects, and the chair or vice chair and the secretary or assistant secretary of the board are hereby authorized and directed to execute and deliver such supplemental indenture, the TRS obligation, and the ISDA documentation in substantially the forms presented at this meeting, together with such changes, modifications, and deletions as they, with the advice of the chief financial officer of the district and upon the advice of the district's financial advisor and the district's chief legal officer, may deem necessary and appropriate, including but not limited to changes, modifications, and deletions necessary to incorporate the final terms of the TRS transaction as shall be set forth in the ISDA documentation, and such execution and delivery shall be conclusive evidence of the approval and authorization thereof by the district. To the extent necessary or desirable, each TRS transaction may be entered into under a separate ISDA documentation and secured by a separate obligation issued under a separate supplemental indenture, in each case substantially in the forms presented as this meeting, with such changes as are approved as stated above. Each of the chair, vice chair, secretary, and assistant secretary of the board is applicable, and the president and chief financial officer of the district as applicable are authorized and directed without limitation except as may expressly set forth herein to take such action and to execute and deliver any such documents, certificates, undertakings, agreements, or other instruments as they, with the advice of counsel, may deem necessary or appropriate to issue the bonds. Appoint any additional fiduciaries or agents necessary in connection with the issuance of the bonds, and otherwise affect the transactions contemplated by this resolution, including without limitation the preparation, negotiation, and execution of all necessary documents in form and content standard for the type of financing selected for the bonds in accordance with this resolution. Section 13, in case any one or more of the provisions of this resolution or any agreement, document, or instrument executed and delivered in connection herewith shall for any reason be held to be illegal or invalid, such illegality or invalidity shall not affect any other provision of this resolution or of any such agreement, document, or instrument, but this resolution and any such agreement, document, or instrument shall be construed and enforced as if such illegal or invalid provision had not been contained therein. And finally, Section 14, this resolution shall take effect immediately upon its passage.
Wow. Thank you.
I apologize.
Thank you so much, David. I move to approve the resolution as it was presented.
So moved.
Second.
We have a motion and a second. Any discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Chair votes aye. Motion carries unanimously.
You want me to
Please
continue?
continue, yeah.
Okay. Today, Maureen Pingree, CPA and partner at Walters Associates, presented the draft results for the audit of the fiscal year 2025 financial statements of the SMH Healthcare Retirement Plan. She stated that the audit went well and reported that the auditors required communications. Ms. Pingree reported that the continued strong investment returns this year increased the plan's funded status to approximately 113% from 105% last year. As such, I move acceptance and approval of the fiscal year 2025 audited financial statements of the SMH Healthcare Retirement Plan as presented by Walters and Associates and as recommended by both the audit and the finance committees.
So moved. Do I have a second? To your motion or any discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Chair votes aye. Motion carries unanimously.
Okay.
Please continue. Thank you.
Next, Todd Webster, CPA from KPMG, presented the results of the audit of the fiscal year 2025 financial statements of the district. He stated that the audit went well and reported that the auditors required communications, including significant audit areas, management judgments, and estimates used in preparation of the financial statements. Based on this, I move acceptance and approval of the fiscal year 2025 SMH consolidated audited financial statements as presented by KPMG and as recommended by both the audit and the finance committee.
I have a motion. Do I have a second?
Second.
To your motion or any discussion?
Just a second.
Yeah, sorry, we have a second. Yeah, sorry, we have a second. To the motion or any discussion? Okay, all those in favor, please signify by saying aye.
Aye.
Any opposed? Chair votes aye. Motion carries unanimously. Bring it in for landing here.
Okay. Next, Todd Nass, Executive Director of Audit Services, provided an update on the internal audit projects. Part of the presentation was given by Jeff Tukau of Profivity LLC relating to the audit procedures performed by Profivity on the invoices for construction projects. There's no motion necessary for that. This is for information purposes only. And lastly, Bobby Pettit, Controller, presented the updated recurring wire transfers and ACH on the payments policy for the approval. At this time, I move approval of the updated policy for recurring wire transfers and ACH and other payments to permit staff to initiate and authorize those transactions as needed, as recommended by the Finance Committee.
Okay, I have a motion. Do I have a second?
Second.
We have a second. To your motion or any discussion? Okay, seeing none, all those in favor, please signify by saying aye.
Aye.
Any opposed? Chair votes aye. Motion carries unanimously. Thank you, Sarah, and all members of the Finance and Audit Committees. Okay, we'll move on to Part B, which is Mission and Planning Committee. Pam Beitlich will now provide us a report.
Thank you, Mr. Chairman. Our Mission and Planning Committee met this morning, and we had 2 approval requests presented to the board. In the first presentation, Robert Santos, Director of Biomedical Engineering Services, and Jen Rosati, our Chief Financial Officer, reviewed a multi-year imaging equipment replacement plan for the healthcare system. The replacement plan would allow Sarasota Memorial to maintain the highest quality of imaging while also optimizing cost savings. I would like to move approval of the Mission and Planning's recommendation for a multi-year imaging replacement plan for a total project amount not to exceed $25,520,000 as presented today.
Second.
We have a motion and a second. To your motion or any discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Chair votes aye. Motion carries unanimously. Thank you, Pam. Please continue.
The second presentation was very enlightening. We learned a lot about the details on the expansion of GI and endoscopy services into South County. Jen Storch, our Vice President of Ambulatory Services, and John Vieira, Chief Financial Officer at SMH Venice, discussed the opportunity to build a GI and endoscopy center across from SMH Venice. The center would include a GI physician clinic and 4 outpatient endoscopy procedure rooms. The core and shell will be constructed through a developer, and SMH will build out the interior. The GI and endoscopy center at SMH Venice is expected to open in Q1 of 2028. I would like to move approval of the Mission and Planning's recommendation for expansion of SMH Venice GI and endoscopy services on leased property with a project cost not to exceed $12 million as presented today.
We have a motion and a second. To the motion or any additional discussion? Okay, seeing none. All those in favor, please signify by saying aye.
Aye.
Any opposed? Okay. Chair votes aye. Motion carries unanimously. Thank you, Pam.
Thank you.
With that, we will move on to agenda item number 11, the President's Report with our CEO, David Verinder.
Thank you, Mr. Chair. I am going to start as we do each month with our organizational report card. Just to orient you on the card, the left side is our December organizational 5 areas that 5 areas of concentration: service, people, quality, finance, and growth. The middle column is our goal that we're trying to strive for. And then finally, on the right-hand side is the score that we're currently running. So starting with service, we have a system goal of having our likelihood of recommending the number of services greater than or equal to the 75th percentile, being 8 out of 10 that we survey. We are meeting that goal of 8 out of 10, and I'll show you the detail on that momentarily. The next area is that of people. We have a goal of having our new hire retention, our percent of regular and full-time employees that are hired within the FY 2025 that are still employed as of September 30th, 2026. We have a goal of being 83% or higher. I'm happy to report we are at 97.28%, so very good there. Next up is that of quality. We have our goal of having our infection prevention, our combined overall standardized infection rate being less than 0.8. Happy to report we are exceeding that as well at 0.54. Fourth one is our finance area. We have our goal of having our operating margin be basically at our budget, which is, it have a typo on the screen. It should be 3% instead of 5%, just because we're loading in our EPIC cost. And I'm happy to report we are exceeding that at 4.4%. And then finally, we have our growth area, which we have 2 goals in that. One being our inpatient admissions and observation outpatients being at 82,071 for the year. We are trending higher than that, trending at 88,089. And then finally, our outpatient registrations, our goal is at 1.224 million. We are also trending higher than that at 1.329 million. Looking a little bit deeper into our patient experience report card, these are the 10 areas that we routinely survey, looking at the likelihood of recommending the organization. The middle column is our actual score. The next column over is the national median score in each one of these. And then finally, on the right-hand side is the 75th percentile score, which is what our goal is built around. So I'm happy to report that we did hit 8 out of 10 of the areas at or greater than the 75th percentile, and 10 out of 10 on a national median score. And you can see where we fall on that. Next up is Sarasota Memorial kicked off 2026 for achieving what no other hospital in Florida could, a perfect 5-star rating from the U.S. Centers for Medicare and Medicaid Services. We've done this every year for 10 years straight. The 5-year rating places SMH in the top tier of medical institutions nationally. Of the more than 4,000 U.S. hospitals evaluated, SMH Sarasota is one of only 17 nationwide and the only one in Florida to earn the 5-star rating from CMS every year since it launched the star rating program in 2016. The CMS star ratings are particularly meaningful because they have summarized the hospital's overall performance across 5 critical areas: mortality, safety of care, readmission, patient experience, and timely effective care. As we cap off our 100th anniversary year, we are pleased that SMH was recently ranked among 100 great hospitals in America. The national recognition from Becker's Hospital Review spotlights 100 standout hospitals that demonstrated exceptional clinical performance, an unwavering focus on patient safety, and an ongoing commitment to research, education, and innovation. Becker's noted that hospitals in the top 100 list have been recognized for sustained quality and safety by multiple independent rating organizations, including Leapfrog Group, U.S. News and World Report, and CMS. Sarasota Memorial was recently recognized in Forbes' first ever list of top hospitals in the U.S. The media company's inaugural Top Hospitals 2026 list identifies high-quality general acute care facilities nationwide that demonstrate superior clinical outcomes, best practices, value, and patient experience. Of nearly 3,000 hospitals evaluated, SMH Sarasota ranked in the 90th percentile and earned Forbes' highest 5-star rating for overall care. SMH's newer campus, SMH Venice, received 4 stars for overall care and 5 stars for patient experience. Congratulations to the teams. Sarasota Memorial Nursing and Rehab Center was named among the nation's best nursing homes, recognized for both short-term rehab and long-term care in U.S. News' recently released annual list of best nursing homes. Since 2009, U.S. News has recognized the best nursing homes, also called skilled nursing facilities, to help people make informed decisions about where to receive nursing home care. The 2026 list recognizes the top 1,200 nursing homes of approximately 15,000 evaluated across the nation. Compared to national averages, U.S. News reported that its top performing facilities on average provide 20% more staffing per resident per day, 80% more physical therapy per resident per day, 15% lower rate of hospitalizations, and 33% lower rate of emergency room visits. Sarasota Memorial Nursing and Rehab Center offers skilled nursing and rehabilitation for people recovering from surgery, illness, or injury. Sarasota Memorial recently announced the opening of our new accredited Sleep Disorder Center, a comprehensive program dedicated to evaluating and treating a wide range of sleep disorders that can impact long-term health. Early diagnosis and effective treatment of sleep disorders can significantly improve quality of life and reduce the risk of high blood pressure, heart disease, stroke, and other long-term complications. At the Sleep Disorder Center, a multidisciplinary team provides comprehensive evaluations, overnight diagnostic sleep studies, and individualized treatment plans for a wide range of conditions. Overnight sleep studies are performed by specially trained registered sleep technologists in private hotel-like sleep suites in our sleep medicine facility, which is accredited by the American Academy for Sleep Medicine. Board-certified sleep medicine physicians meet with the patients to discuss the results and potential treatment options. Long-term Sarasota Memorial leader Frank Morgan has been promoted to president of the Sarasota Memorial Hospital campus, the Sarasota campus. Previously, Frank had served as chief operating officer of the Sarasota campus. In his new position, he will assume a dual role overseeing day-to-day operations and overall performance at a flagship 897-bed hospital, and work with the medical and nursing chiefs and other senior team leaders on strategic goals and key initiatives for the health system. Before serving as the chief operating officer, he was the vice president of Sarasota Memorial's Ambulatory Services Division. Frank began his career at SMH in 2002 as an administrative fellow after graduating from the University of Missouri with a master's degree in healthcare administration. He progressed through a series of senior leadership positions and was instrumental in developing and implementing SMH's highly successful outpatient growth strategy. So congratulations, Frank. Sarasota Memorial is pleased to announce that Wilhelmina Visa-Ramesh, Dr. Wilhelmina Visa-Ramesh, was named the 2025 recipient of the Outstanding Contributions to Advancing the Careers of Women in Medicine Award by the American College of Physicians Florida chapter. The prestigious award recognizes physicians whose leadership, advocacy, and mentorship have achieved meaningful opportunities for women in medicine across Florida. As our chief academic officer at SMH, Dr. Visa-Ramesh oversees the health system's expanding graduate medical education programs and research initiatives, which help create a robust pipeline of new physicians serving Florida and the Suncoast region. Since launching Sarasota Memorial's GME program with Florida State University a decade ago, the program has more than tripled in size, providing specialty training to more than 70 physicians a year in residencies and fellowships at SMH. On average, more than half of the resident physicians remain in our region after completing the residencies, and 70% have established practices in Sarasota rang in the new year by welcoming our first babies of 2026 at both the Sarasota and Venice campuses and early hours of January 1st. The first baby of the year was born at SMH Venice. Zeta Zimmerman, effectively known as Zaz, arrived at 12:50 a.m. His uncle was the first baby of the year at Sarasota Memorial 14 years ago. At Sarasota campus, Austin Gordon Jr., known as AJ, was born at 1:25 a.m. His arrival came just 14 weeks before Dad's own birthday. Nursing teams at both campuses celebrated the New Year's arrivals by presenting each family with a special New Year's baby basket filled with gifts. In 2025, the health system helped welcome more than 4,860 babies. This is a list of our physician lectures that are on cardiac care repair that are coming up in the month of February. I would just invite the public to go on our website and take a look at this. If you want to attend any, we just ask that you RSVP. They're all free lectures, just so we get a head count of who's coming in. But always find these very interesting and appreciate the doctors for doing it. And Mr. Chair, that is my report. Happy to answer any questions.
Thank you, David. Any questions for David? Okay, seeing none, we will move on to agenda item number 12, which is our public comment section. Right now, we have 3 members of the public signed up to speak, so comments will be limited to 5 minutes. Commenters are reminded of the rules of civility that you have agreed to upon entering the meeting today. I won't interrupt you as you come to the end of your permitted time, but I will let you know when your time is up, and you can also see your allotted time remaining on the screens in the room. I will call you up in the order within which I've received the cards, and you will have 5 minutes to present. First is Saul Kilstein. Thank you, Mr. Kilstein. You will have 5 minutes.
Thank you. And sorry I wasn't here to congratulate you on your appointments as officers. And I promise not to take as long as the reading of the resolution. Some of you may be old enough to remember Nelson Rockefeller, who was an esteemed 4-term governor of New York State. He was considered to be a great governor, but as the projects in the state capital of New York, which took down 40 square blocks and was meant to be his landmark building, took years and years and many overruns. Nelson Rockefeller was deemed to have an edifice complex. So as I look at the focus of the board on its many buildings, I remind them to keep their focus on the healthcare that's being delivered. I wasn't expecting to read 357 pages of the agenda that was put before the board, but I did pay attention to some of the attachments, including the board's summary attached to the board bond resolution. And I found the 75 page attachment of bondholder risks very interesting, particularly the way it articulated quite exquisitely the remaining relatively politically benign, rapidly changing and unpredictable regulatory environment that the district was going to be facing. The current federal legislative and executive posture regarding the healthcare industry, including with respect to Medicare, Medicaid, and other matters that are important to the district, are in a state of rapid flux. The outcomes that are not currently possible to predict, but could be adverse to the district. Very well said. Congratulations. I will be addressing some of that, and perhaps not as politically polite. Cuts in Medicare and Obamacare are going to mean more patients showing up in your emergency rooms and urgent cares, and many of those patients are going to be sicker. The administration just announced essentially flat reimbursement to the Medicare Advantage plans, and the stocks for the major Medicare Advantage plans dropped 8 to 10% today. That's going to mean hard negotiations with your system over the coming year. Federal immigration policies, including HB1 visas for healthcare professionals, visas for nurses and other healthcare professionals, and just the general environment to hire everyone from your housekeepers to your nursing aides is going to be very difficult. And we're talking about a 30-year bond in some cases. So the demographics of changes in vaccine policies, the demographics of your healthcare system, you got to look at the long term. And these are the macro issues that I've talked to this board about. The United States has withdrawn from the World Health Organization. Now, some people focus on the latest flu vaccine, but what about COVID? And what about global pandemics that we haven't even thought about? These are things that I worry about. Scientists predict a increase in disease related to the elimination of mandatory vaccines or recommendations for global vaccines. These are the things that I worry about. The new head of ACIP doesn't believe in childhood vaccines and says, yeah, some kids are going to die from measles and some kids are going to be paralyzed from polio. These are the things I worry about. So in short, I'm asking the board to really empower your medical directors and professional staff to develop strategies and implement strategies that are going to be looking over the horizon to those activities that they need to be empowered to address the naysayers and the people who don't think healthcare, immunizations, and the healthcare regulations that are going to have to be answer to patients who are reading or hearing on Fox News are no longer important. They need answers.
Thank you, Mr. Kilstein.
Thank
Time has
you.
expired. Next, we have Lisa Roulette. Thank you, Ms. Roulette. Likewise, you will have 5 minutes.
The CDC's Vaccine Advisory Committee had a question on their mind when they met last month. They wanted to know, when it comes to giving the hepatitis B vaccine to babies of Hep B negative moms, how risky is it to give the vaccine at birth? They decided to pull up all the trials that examined the safety of the birth dose. What do you think they found? A member of the committee described what they found. The data used to approve the hepatitis B vaccines for infants were based on studies that had very short-term follow-up and no control group. We would never approve a vaccine based on data like that today, end quote. She also said, if not a single randomized placebo-controlled trial has ever examined the safety of the birth dose, on what basis can we confidently assert that this policy is necessary for every newborn? As a result, my understanding is that the CDC has stopped recommending the hepatitis B vaccine as routine at birth for babies of hepatitis B negative moms. Instead, the CDC has officially made it quite acceptable to wait until the baby is 2 months old or older before giving the first dose. Because again, except for babies born of Hep B positive moms, my understanding is that Hep B is primarily contracted from risky sexual activity and by self-injecting illegal drugs using dirty drug needles. And I think that you'll agree, the chance of Hep B negative babies engaging in those activities between birth and 2 months is quite low. How does that make you feel? To have been injecting a substance into newborn babies for dozens of years based on safety assurances from the CDC that have now been shown to be completely empty and unjustified, with no placebo-controlled safety studies for the birth dose. Moms and dads deserve to know what the pros and cons are for injecting their babies at birth instead of at the 2-month checkup. They deserve to know that they could actually be doing more harm than good to their newborn by rushing the shot instead of reevaluating at the 2-month checkup. Do you want them to know? Will you make sure they're told? It's risky to give the hepatitis B vaccine to newborns. Many other countries recognize this, as per the CDC Advisory Committee's chart of Hep B policy around the world. Here's just one example of specific harm out of many. One mom who lives in Sarasota County says 5 hours after her baby was born at a different hospital, he was injected with the Hep B vaccine. She said 1 hour after that, he stopped breathing and turned purple. For months after that, he would stop breathing when lying down, so had to sleep upright. Apnea is a known side effect of the Hep B vaccine. In the past, some of your statements have seemed to imply that huge safety concerns with vaccines given to patients here are not your problem. But making sure doctors know the facts they need to provide true informed consent is your problem. Making sure parents receive true informed consent where they're advised of all significant safety facts and the pros and cons of all their options is your problem. All of us, I imagine, have held a newborn baby. We know how precious they are and how vulnerable they are. We need to make sure that protecting them, in part through robust informed consent reflecting these new CDC findings, is Sarasota Memorial's #1 priority. I am very worried about the recent CDC findings of lack of safety confirmation of the Hep B vaccine birth dose for Hep B negative babies born of Hep B negative moms. I would love peace of mind on behalf of newborns here. I ask that each of you reach out to me and let me know what's your plan now, given these findings? What are you going to host a training session for doctors? Are you going to bring in experts? Because this has got to be mind-blowing for them. I bet some of them don't believe it, that there's no safety confirmation of these vaccines. I would recommend that you bring in maybe one expert who says, I think we should keep giving the birth dose, one expert who says, I agree there are no safety studies, and give all these doctors a chance for a Q&A. And I would also like to know, what are you going to tell parents? Because we need to make sure they know all their options, and they need to know that they were not able to find a single study confirming safety. Thank you.
Thank you, Ms. Thank you, Ms. for that. Finally, we have Ruth Brandwine.
I'll pass.
Just for the record, Dr. Brandwine is waiving her time. And with that, having completed our agenda, I've been informed there's no other legal matters or other business for this meeting, so we stand adjourned at 3:03 p.m.